crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening is the last of my informal series on more lesser known sleep disorders. And I've finished with insomnia because though people know what insomnia is or think they know what insomnia is, it's more than they think. So what exactly is insomnia? It's a sleep disorder in which you have trouble falling asleep or staying asleep or staying asleep. The condition can be acute, which means it's of short duration or recent history, or it can be chronic, meaning it's been lasting a long time. It can also be periodic and come and go. Whereas acute insomnia lasts from one night to perhaps a few weeks, it becomes chronic when it happens at least 3 nights a week for 3 months or more. Though I think people's tolerance level is probably a lot less than that. But that's the medical definition anyway. Now, there are 2 types of insomnia: primary insomnia and secondary. Primary insomnia means that your sleep problems aren't linked to any other health issue or condition. Whereas secondary insomnia means that you have trouble sleeping because of some other problem. For example, asthma, depression, arthritis, cancer, or even heartburn. Now, some of the causes of primary insomnia include stress-related events like a job loss, change, or divorce, things like that, death of a loved one. Things around you and things in your environment like noise or light or temperature. Changes to your sleep schedule. Perhaps you're doing shift working, or you're suffering from jet lag, or you've just developed bad habits from other sleep issues you may have had. Now, with secondary insomnia, the causes of that can be mental health issues such as depression or anxiety, medications, cold medication, allergy tablets, medication for depression or high blood pressure and asthma may be a cause of the insomnia. Pain or discomfort at night, whatever the origin. Caffeine, tobacco, or alcohol use, particularly late at night, can be a problem. Endocrine problems or glandular problems such as hyperthyroidism, where your thyroid is overactive. And then there's other sleep disorders like sleep apnea, where you stop breathing, or restless leg syndrome, which I talked about last week. Now, some of the symptoms of insomnia include, obviously, sleepiness during the day. If you're not sleeping at night, you're going to be zonked out during the day. But fatigue in general, poor mood, you have trouble concentrating, and your relationships will not go well. And not only that, your ability to think clearly is definitely impaired when you haven't had a good night's sleep. But to be certain that this insomnia is a problem for you, your doctor would probably need to do a physical exam as well as take a medical history and particularly focus on your sleep history. They may do things like ask you to keep a sleep diary for a week or 2 to keep track of your sleep patterns and how you feel when you wake up the next day. They may also talk to your partner if you have one to find out how well you're sleeping and suggest perhaps further tests at a sleep clinic. There are treatments available for insomnia, and for acute insomnia, that of short duration or occasional episodes, they may not need treatment. I mean, if you had a presentation to do the next day at work and you were up all night kind of chewing the fat as to whether it's going to be okay, theoretically, once the event has passed, your sleep pattern should return to normal. So it may not actually need to be treated. But If you're really having trouble functioning for a short time and unable to do everyday activities, your GP or consultant may prescribe sleeping pills for a short time only, because people do get hooked on these things. Medicines that work quickly but briefly can help you avoid problems like drowsiness during the day. It's not suggested that you use over-the-counter sleeping pills for insomnia. They may have side effects, and over time, they become less effective. However, for chronic insomnia, you need treatment for the health conditions or problems that are keeping you awake. Your doctor may also suggest something like behavioral therapy if anxiety and stress may be part of the mix in terms of what's keeping you awake. This kind of therapy can help to change your way of thinking and reacting so that you're less affected by the insomnia, as well as learn as what you can do to promote better sleep. What can you do to prevent insomnia? Well, the first thing is to develop good sleep routines and habits, or sleep hygiene, that can help you to beat insomnia. Some things that you could do is perhaps really developing and sticking to a good routine each night, going to sleep and getting up at pretty much the same time every day. And also try not to take naps during the day, because if you're sleeping during the day, you're going to be awake at night because you've already paid some of your sleep debt, you might say. Try to avoid using your phone or reading ebooks before going to bed. The blue light that they emit will decrease the levels of melatonin and serotonin, which are important sleep hormones and only produced when you go to sleep. So avoiding your Wi-Fi, avoiding anything electronic in the run up to going to bed would really, really be helpful. I have helped a number of clients with this simple suggestion of leaving the Wi-Fi out of their bedrooms to get better sleep. And it's worked in many cases. So it's something you should think about. Obvious things like avoiding caffeine, nicotine, alcohol late in the day, because they can stimulate the system or create other problems which will keep you awake. Regular exercise, while recommended for improving sleep, really needs to be well spaced before bedtime. In other words, no more than 3 to 4 hours before you go to sleep, because these stimulants, taking the time to actually relax and come back down, could actually prevent you from getting a good night's sleep. Now, this might sound a bit directive, but you might want to consider not using your bed for anything but sleep and sex. Everything out extraneous to those two purposes needs to come out of the bedroom. So no TVs, no radios, no Wi-Fi of any kind should be in there. Only action that should be going on is the action you create for yourself before going to sleep. And finally, if you have a tendency to lie awake and worry about what you need to do the next day, make a to-do list before going to bed. Therefore, it's no longer running around in your brain like little animals in a cage, and you'll have your ideas set for what you want to do the next day. So there you have it. Insomnia is more than what you think it is, I hope you realize. And if that's something that you think may be an issue, whether it be of short duration or chronic, and before going to your doctor, talk to me. I might be able to suggest things that will short circuit your need to actually go to the doctor, who will probably hand you a prescription for some sleeping pills, and send you on your way. So if you're looking for drug-free and simple, natural ways to deal with poor sleep, book a free consultation and find out more. You can reach me at www.meetingwithsheila.com and book an appointment then. Thanks so much for watching and listening. Have a great evening and a wonderful week ahead, and I'll see you again soon. Take care. Bye-bye.